Very early signs and symptoms of pregnancy in first week. The journey of pregnancy is a miraculous and transformative experience for women. While it's common knowledge that pregnancy spans 9 months, many may not be aware that the first week is crucial in terms of development and can bring about subtle yet significant changes. In this video, we'll explore the early signs and symptoms that may manifest during the first week of pregnancy. Implantation bleeding. One of the earliest signs of being pregnant is implantation bleeding. This phenomenon occurs about 6 to 12 days after conception when the fertilized egg attaches itself to the uterine lining. The result is regularly mild spotting or mild bleeding, without difficulty improper for an early menstrual duration. What distinguishes implantation bleeding is its timing, occurring out of doors, the everyday menstrual cycle. While the quantity of bleeding is typically minimal, the duration and color may vary. This subtle sign heralds the beginning of a first-rate method as the fertilized egg begins to set up its connection to the uterus. Fatigue. The first week of pregnancy brings approximately a surge in hormonal activity and a growth in metabolic techniques as the body prepares to nurture a developing life. Consequently, many women experience an awesome experience of fatigue. This fatigue isn't the same as the tiredness encountered in everyday existence. It's a deep, pervasive weariness which could set in early on. The body redirects electricity to aid the speedy changes taking place inside, leaving women feeling especially worn out, even with good enough relaxation. Understanding and acknowledging this early signal of pregnancy is critical, prompting expectant mothers to concentrate on their bodies and prioritize rest for the duration of these preliminary ranges. Breast changes. Hormonal fluctuations during the first week of pregnancy contribute to substantial adjustments in the breasts. Many girls report tenderness, swelling, or expanded sensitivity in their breasts. The areolas may also darken, and a heightened cognizance of these modifications frequently becomes obvious. These early breast changes characterize the frame's preparation for the vast position of breastfeeding in the months to come. As the body adjusts to the needs of the pregnancy, those modifications function a physical reminder of the outstanding transformation taking place within. Increased basal body temperature. Tracking basal body temperature is a commonplace approach for the ones attempting to conceive, and during the primary week of pregnancy, it can offer precious insights. After ovulation, a sustained growth in basal body temperature can also indicate the onset of pregnancy. This diffused shift is a result of hormonal modifications, specifically the upward push in progesterone stages. While the increase can be slight, it's far regular and can be detected through everyday temperature tracking. Recognizing this early sign empowers girls with a proactive method to family planning and underscores the tricky interplay of hormones orchestrating the early stages of pregnancy. Changes in cervical mucus. Another diffused but big indicator of being pregnant during the first week includes changes in cervical mucus. Hormonal fluctuations, especially increases in estrogen tears, contribute to change in the texture and quantity of cervical mucus. Women may additionally note an exchange in consistency, with the mucus turning into thicker and stickier. This transformation is part of the frame's herbal response to the fertilized egg's presence, growing in surroundings conducive to a HIT implantation. Paying attention to these nuanced adjustments in cervical mucus gives a precious clue to the continuing tactics inside the reproductive device, presenting perception into the early degrees of being pregnant. Mood swings. Hormonal shifts are an indicator of early being pregnant, and these fluctuations can have a set effect on mood. During the first week, many expectant moms feel heightened feelings or temper swings. The surge in estrogen and progesterone stages can create a hormonal roller coaster, main to a number of feelings from elation to tearfulness. While those temper swings may also appear unpredictable, they're an ordinary response to the intricate dance of hormones orchestrating the early stages of pregnancy. Understanding and acknowledging these emotional shifts permit women to navigate this era with self-compassion and speak successfully with their help gadget. Nausea and morning sickness. While commonly associated with later levels of being pregnant, a few girls may additionally experience nausea as early as the first week. This early signal of being pregnant, often known as morning sickness, manifests as queasiness or aversions to certain smells or foods. The precise cause of morning sickness isn't always completely understood. However, hormonal modifications, particularly the rise in HCG, are believed to play a position. Though it may not be as extreme as in later weeks, the occasional bout of nausea throughout the first week serves as a gentle reminder of the frame's ongoing changes to aid the growing pregnancy. Managing these signs and symptoms with small, common meals and staying hydrated can assist girls navigating the initial tiers of morning sickness. Increased urination. As the uterus undergoes early expansion and begins to exert stress on the bladder, expanded frequency of urination turns into a common symptom all through the first week of being pregnant. While the embryo remains in the early stages of development, the body starts making ready for the physiological changes in an effort to accommodate the growing fetus. The accelerated want to urinate may emerge as more major as the first week progresses, signaling the start of this bodily adjustment. Though it could be inconvenient, information that this symptom is a herbal part of the frame's coaching for pregnancy allows ladies to navigate this thing of the early tears with staying power and attention.